Where are we on healthcare? And, given that you're on the more Republican side of things, do you see an outcome here that's beneficial to your side of the aisle?
So at Premier, we work with 3,700 hospitals and healthcare systems and 100,000 plus physicians and other organizations. They are all focused on the fundamental problem, which is whatever happens with a Republican bill, with a replacement proposal, the fundamental problems haven't changed, which is we have to figure out at its core the cost problem, the quality and safety and outcomes problem. And so all of the Premier health systems are focused on how do I actually move forward with these value-based payment models? And nobody's actually talking about that. It's an important part of Obamacare and not a part that we're talking about changing. So if you think about it and you go out to your car in the morning and you have two lights on in your car and one says change the oil filter and one says engine light, check your engine. That's the core of the challenge, and we're talking about a whole bunch of other stuff.
If there was political will to do it, there would be political will to do it, Susan. There clearly isn't.
I think the challenge is it's very big and it's very complex. And you have some states that have expanded Medicaid and some states that haven't. And I think what healthcare providers, they're serving all these populations. And these populations are going to end up in healthcare systems no matter what this reform bill looks like. So the question really is, how do they sort of stop the big, massive, even though it's a campaign promise they're trying to keep, change and say, let's start incrementally fixing the problems, because there are several problems that could be fixed incrementally.
Such as?
Such as forcing vendors to make the data interoperable, such as regulatory barriers that get in the way of healthcare systems being able to unite and work together, such as fixing the exchanges. There's a lot of that they could do with incremental bills that they might have more success.